This brings us to the second panel discussion on challenges in sustaining healthcare. And I'd like to introduce our eminent members, starting with our respected moderator, Mr. Richard Dasselaar, Chairperson, Artificial Intelligence in Cardiology Working Group, International Society for Telemedicine and eHealth, Ms. Hana Ibrahim Abu Shabir, Corporate Senior Nursing Informatics Officer, Abu Dhabi Health Services Company, Dr. Nasseer A. Masoodi, Chair Informatics Optimization Committee, Hamad Medical Corporation, Dr. Gursev Sandlas, Chief Robotics Pediatric Surgeon, Pediatric Urologist, Kokilaben, Dhirubhai Ambani Hospital, Dr. Bhupendra Kumar Rana, Chief Executive Officer, Quality and Accreditation Institute, QAI. And lastly, we have Dr. Ahmad Shamsodini, Chief of Surgery Department, Wakra Hospital. Over to you, Richard, to moderate this wonderful panel. Richard, I assume you're talking on mute. We can't hear you.
It's been 2 years and still I make that mistake from time to time. Thank you for the kind introduction. Thank you for setting the stage right and welcoming myself. First of all, I would like to thank the Qatar Telehealth Technology Summit for organizing what I feel is a marvelous and exciting event full of esteemed leaders with the opportunity to show us their latest thoughts and insights on how to move the needle in the field of technology for healthcare. Also, a sincere thank you to the sponsor of the event, Philips and Advanced Care, and most important, the audiences for taking the time out of your days for inviting us for the panel. Having that said, please allow me to start with introducing our panel with the distinguished panelists of Ms. Hana Ibrahim Abu Sharib. She's the Corporate Senior Nursing Informatics Officer at Abu Dhabi Health Services Company. Second, we have, I'm not sure if he has joined yet, distinguished panelist Dr. Ahmad Shamsodini, Chief of Surgery Department at Al Wakra Hospital. It's part of the Hamad Medical Corporation. Dr. Nasseer Al-Masadi, Chair-Informatics Optimizations Committee of Hamad Medical Corporation. Dr. Bhupendra Rana, the CEO of Quality and Accreditation, and the distinguished panelist, Dr. Gursev Sandlas, Chief Robotic Pediatric Surgeon and Pediatric Urologist at Kokilaben, Dhirubhai, Ambani Hospital for the India region. First, I'll please share a quick introduction on my thoughts of what has happened to us all over the world and in all regions with facing the corona pandemic. And it reminded me of a quote that I recently learned last year when I was attending a university in the United States. And it's that nothing is more powerful when an idea is time has come. I think we've had the technology and nature has provided us with a unique momentum to experience the feeling that we all have of creating a more integrated health ecosystem for all people, for all patients everywhere. We know very well that the world is VUCA, and VUCA may be an academic term for a volatile, uncertain world where we need to adopt new mindsets. A mindset of resiliency for the COVID pandemic and to create our data management or data measurement systems for the patients with the technology, with the implementation of good quality and regulatory frameworks to optimize to a modern strategy. And I've been listening with interest to our previous panel on how to execute the strategy. And we know it's a challenging thing. We've been thrown into a pandemic where we do the best what we think that is achievable at the moment, but we also know that we cannot see the entire shift. So we need to take this paradigm shift step by step. As a final thought, before I introduce the first questions to Dr. Hana, I feel we need to reimagine our future, manage our todays with superior excellence, but also change the habits that do not serve us today while we create tomorrow. Please allow me to go to our distinguished panelist, Ms. Hana, with the first question. May I please ask Dr. Hana, what is the telehealth impact on nursing practice?
Hello, everyone. Thank you for giving me this opportunity. My name is Hana. I'm from Abu Dhabi. My work background is in nursing. And as of nursing, I would like to reflect into the teleservices. Now, the teleservices with the new era and digital demand had modified the traditional nurse's role from being a caregiver and an advocate, patient educator, counselor, or even a collaborator into more proactive, interactive, and more therapeutic part. And there is also additional preventative and authenticating part, and that added with our encompassing enlarging the nurses' competencies to accommodate some digital skills to cope up with what's coming from technology and to understand its significance and impact on patient quality of care and safety.
Very important and timely thoughts. Thank you very much for sharing those. I saw Dr. Ahmad. Dr. Ahmad, thank you. My first question for you for this first round of questions. Challenges in telemedicine for surgical patients. May I please ask your thoughts and considerations?
Thank you very much for this question. It's really challenging for not only the surgical unit. We have been forced to use the telemedicine during the pandemic, whether we wanted or we didn't want it. We were using, as a surgical field, the telemedicine for years and years, showing our videos of the surgery with the other for the sake of the exchange of the experience. But for the pandemic, we have to use for the other use of the telemedicine or telehealth with the patient. Unfortunately, the surgical unit in general have, comparing to the other specialty, have used around 10 to 11%, comparing to the radiology that they were using more than 50%, 60% of their service, they shifted to the telehealth. Among the surgeons, it seems that the urologists and neurosurgeons are the highest people who were using the telehealth comparing to the others. And this is because of the imaging. They were concentrating mainly on the imaging, relying on the imaging for their diagnosis. We don't have to forget that we as a surgeon, to reach to the diagnosis, we use a physical examination. And this is missing in the telehealth. We need a platform that can facilitate this. So the tactile sensation, we have lost in it. And we need to see the patient in some stage. This has made the surgeon to delay, and maybe they will ask the patient to come in to see in the person also. And unfortunately, we have a lack of the perfect platform still, that audio with the video call, and you have a problem of the internet connection, and the patients have learned also. At the same time that we have learned, the patients have learned how to say their complaints through the phone call or through the video call. Having a private space for them was a challenge also, because they were in the middle of the work and then you are calling them. So all these challenges we have faced, and I hope that we will have some perfect platform that can resolve all these pitfalls or all these problems.
Thank you, Dr. Ahmad. It's been insightful to learn from you. I'd love to come back to this on our second round. For my next question, Dr. Nasseer, may I please ask, do you think that the surge in telemedicine due to the pandemic will play a key role in accelerating healthcare organizations' adoption of a smart health ecosystem? Over to you. Dr. Nasseer, the classic, yeah.
Awesome. Thank you, Mr. Richard, for moderating this session, and thank you for the opportunity to present in this forum. So as we all know, COVID-19 pandemic has radically accelerated the adoption of digital health technology. And as the pandemic accelerated, multiple factors, including the desire to avoid clinic or hospital settings, limited patients' direct access to medical care. So as a result, patients utilized remote consultations to receive care while remaining safely at home. The result was a massive spike in telemedicine adoption by consumers during the pandemic. For service providers, adoption of telemedicine was a medical and a business imperative, not an option. So globally, countries have experienced a shift to the virtual care. This pandemic drew a necessary shift towards digitally enabled. Remote care has already reshaped care delivery in the near term. But what remains unclear is whether the surge in telemedicine has made a consumer and physicians more open to virtual care in the future, and whether it will accelerate healthcare organizations' journey towards a smart health ecosystem. So healthcare organizations observed that shifting as much as care possible to virtual channels enabled them to attend more patients during the pandemic than would have been possible otherwise. Thus, it is not surprising to know that a vast majority of such organizations and physician practices plan to accelerate the introduction of digital technologies. So like our organization, Hamad Medical Corporation, most institutions will envision the future of digital health as a connected and highly accessible network of both virtual as well as in-person care, with a real-time predictive insights supporting care collaboration across the patient journey. While the healing power of human touch is a key belief in medicine, but the pandemic has revealed that in-person interactions are not always necessary. I am very much of the opinion that in post-pandemic days, patients will continue to access care from the different settings, encouraging healthcare providers to meet patients where they are with a personalized service that suits their needs and preferences. However, payment models will have to be aligned accordingly.
I fully agree with what you say, Dr. Nasseer. It's been an honor and pleasure to learn from you on this first round. I look forward to coming back. That brings me to Dr. Bhupendra Kumar Rana. Doctor, may I please ask, what's your key advice to make sure the right process are in place in the light of quality and accreditation perspective? And the sub-question, can we be too careful versus delivery of care while implementation?
Thank you very much, Richard, for wonderful moderation. And thank you all the panelists for wonderful insight. Thanks to QTT Summit for the opportunity. I think this is a great question, Richard. I must thank for that question. And as Nasseer mentioned, telehealth become a requirement, not an option. And in last 2 years of pandemic has forced healthcare organizations to adopt different methodologies to provide care. And telemedicine, of course, has been in practice in some of the countries for long, but in many parts of the world, it has just a beginning. And I think a lot need to learn. And as any new innovation or any technology-based system has also its own risks and benefits. And we need to really weigh risk versus benefits. And I think telemedicine has been shown as more weighing towards benefit than risk. However, as a new intervention, whether it's clinical or non-clinical, everyone has to really look at. And accreditation, in my perspective, for over 20 years of experience, has emerged as a very strong tool for ensuring that required processes are in place, because accreditation is a combination of what we call it structures, process, and outcomes. And structures are basically those which are actually being in place almost through the regulation, as in hospital or healthcare facility. But unlikely those healthcare facilities, telehealth may not find regulation in many parts of the world. And therefore, the provider really look at it, that what structures they need, whether in terms of they have adequacy in terms of telehealth consult, which they are offering to the patients. And then, of course, the processes are very important. And process starts from even recognizing the doctor who is providing teleconsult and the patient who is coming to take the consultation. That's the very first thing, the recognition of identification of the provider, consultant, and as well the patient who is coming, because at times that you know better than anybody else that the medications when you prescribe as an age basis, and if you really don't know the age of the patient, which is almost too close to the the correctness, you might be wrong in prescription. So the process you need to start from the identification of the physician or the consultant as well as the patient, and then the assessment, the clinical assessment will need to be done for diagnosing the proper things, so diagnostics, and then when you are prescribing medications. So as you know, in hospital, we set a guideline that how you should be prescribing medications, not to make any error, write in capital, or if you're not typing, and then proper advice, how many times a day, when you should take, not TDS, BDH, HS, So these are how you prescribe medication, and what medication actually you can prescribe through teleconsult. Because say, for example, in India, we have certain regulations that you cannot prescribe certain medication when you are providing teleconsultation. So that most goes to the regulatory aspects of individual countries. And then, of course, in between of these is a consent process, consenting the patients, though it is deemed consent when patient comes in a hospital. But what about your teleconsultation process? So I think there's a lot of processes need to be controlled. And accreditation is considered as a very valuable tool because there is someone from outside really providing an oversight on the processes, how you are providing teleconsultations. Because it's not just when somebody get the consultation through video on a mobile phone, but for the provider, it is important and how they really record all those consultations. Right? Even transferring the medication prescription to the patient in a confidential manner, and also keeping the record at their own end. How they record safely and securely, keeping the confidentiality, and how long you need to keep the data and information of the patient in case the patient will come for follow-up. So I think all these processes and stages in a teleconsultation are not different than a hospital setup. And therefore, for telehealth providers, it's very important that while they are doing all their best efforts in providing telehealth consultation, they really need to adhere to all those policies and procedures which really need to help them in terms of their reliability, credibility, and patient safety aspects. So I think these are my opening thoughts in the beginning to let the floor open. Thank you so much, Richard. Thank you.
Thank you. Thank you, Dr. Rana. It's been an insightful introduction. We are well on time for our panel, give and take all variables considered. Dr. Gursev, on to you as an expert for India and the chief robotic system. Doctor, may I please ask, do you think post-COVID, the interaction between doctor and patient, has that changed forever? And could you please elaborate on that?
Yeah, thank you, Richard. I think that's a very relevant question today, and I think pandemic has changed a lot of perceptions, especially in the medical fraternity when it came to patient-doctor interaction. The traditional model of a patient visiting a hospital, taking an appointment with a doctor, and then seeing him after waiting for a considerable period of time, I think that has changed forever. The paradigm has shifted permanently, in my view. See, being a pediatric surgeon, I deal with predominantly what we call the millennial age group, because most of the parents today are born after 1990. So they grew up with the internet. They are more comfortable with that technology. Anything you tell them, the first reaction of theirs is to Google it. So they are comfortable with the mobile and the technology. And I think what we have seen in the last 2 years is, compared to the hospitals, the patients have actually taken up the technology much faster and in many innovative ways. See, we deal with mainly complex urogenital reconstruction in children, and these are kids who need frequent follow-ups, visits to the hospital, and it's always a distressing experience as far as the patient is concerned. And all the visit used to entail was a few questions, maybe a cursory examination to see how the child is doing and how they are performing in school, how are their habits. And I think all that has now shifted on to the online platform as far as we are concerned. The only time I try to make the patient visit a hospital is for a procedure or for a surgery. Pre-operative visits, and barring the first post-operative visit when you remove the sutures, we try to keep them as much as possible online. And what has done that is it has actually spread our reach all over the countries. India is a big country. From one end to the other, it's almost 2,000 miles. So for a patient to travel 2,000 miles for a 5 or a 10-minute interaction with me doesn't make sense. So we have tried to shift all that to online. Just yesterday, I had a patient from North India, probably about 1,000 miles away from me. And the first interaction was online. We discussed the treatment options, and they landed up today to proceed with the surgery. So I think it has changed the paradigm completely and more or less permanently. And in fact, in the future, the patients will look forward to a telehealth consultation either prior to meeting the patient, the surgeon physically, get that confidence in that person, in that doctor, and then come back for the surgery and then have further follow-ups online. I think it's changed for better, and it's quite exciting times ahead for us. We need to change accordingly and fast. Thank you.
Thank you, Dr. Gursev. Highly insightful. Dr. Hana, through for the second round to you. May I please ask the follow-up question, what are the implications of a point for nursing in telehealth services? I'm curious for your thoughts. Dr. Ms. Hana, the classical. Thank you.
Okay. So the telehealth for nursing is utilized mainly in terms, and it was utilized historically after a natural disaster, and just recently, what we had in the COVID crisis, where there is a demand still to continue the process and to continue the care of the patient, even though that there is a geographical distance. The scope that is identified are triaging mainly, and teletriaging, modifying or identifying who are the patients will be at risk, and identify and navigate the risk of or acuity of their cases, and navigate them through the healthcare system, addressing them into categories and then transferring them. The other part is offering an OPD structured care services of education that's given, for example, for a dedicated group of diabetic patient or hypertensive patient. And all of these activities help the physicians even to have the patient informed and prepared before they will go for the consultation. Usually the nurses for such scope, they are receiving the referrals from the physician, where the structured patient education and dedicated education is given, for example, for diabetic patient or lactation consultant or perinatal, and that offered a great support for OPD services. And for ED services, the triaging was the major success for the nursing, but yet there are other areas which is coming in the future, which is related to telepediatric, tele-mental health, anonymous support system, online support system, symptom checkers, and even home care, and the dispensing of some items of supplies or health supplies for the patient through the nursing services.
Thank you, Ms. Anna. Thank you. It's appreciated. I'd like to have taken good notes listening to you. I'll please follow back on the wrap up. But first we go through Dr. Ahmad with the second question of the panel. Dr. Ahmad, may I please ask how to protect the patient's rights and privacy in this search of telehealth technology?
Yeah, I think this is the biggest challenge. And I think Dr. Rana have mentioned some of these challenges. So what is the credential? How the patient credential is will be implemented for the telehealth? How the patient can put the consent? How much is the liability of the consent over the telehealth? Whether we can depend on it, because if you have a medical legal case that you need to investigate, and we have to know about the liability of those type of consent. It's very important to consider the role of the language barrier. So what you will do during the telehealth and consultation online, and you need a translator to come in and translate it for you. We have it in the Gulf area, and it's very common. And the legal aspect, I think there is a big gap still for the legal input in this. How much is the liability of what we are doing? How much we can rely on it? So at the end of the day, I believe that we need to have something called end-to-end encrypted system in the telehealth, that nobody, the third party, cannot enter it. So it should be secure. So I think we have a lot of room still in improving of safety of the patient. It's only the beginning, and I think the rest in the coming months or years, we will be facing a lot of these aspects in the future.
Thank you, Dr. Ahmad, for an insightful view. On to the second or the third speaker for the second round. Dr. Nasseer, what role do you think governments and regulatory bodies can play in supporting and sustaining telehealth initiatives?
Thank you, Richard. And some of our panelists have actually alluded to some of those issues in their previous conversations. But just to I think we all know by this time that digital transformation of healthcare is not just about adopting new technologies. It's about actually reimagining the healthcare landscape for the digital age, that is using the power of data, artificial intelligence, cloud-based platforms, and new business models to improve the health outcomes. It's about changing the health culture, actually. So the challenge is not to introduce digital technologies into health sector, what is known as digitization. It is more about the transformative change, to integrate the use of digital technologies in the health sector modernization efforts, in changing our workflows and in changing our interactions. So digital transformation can support better health outcomes, improve patient and staff experience by empowering them, and lower cost of care by enabling people to take care of their health and well-being with personalized digital health solutions. To turn this vision into reality, governments and regulatory bodies have to play a significant role in supporting the modernization of healthcare systems. These authorities can work with the healthcare leaders to overcome several barriers. I think some of the issues that just Dr. Ahmad was highlighting, the issues with the interoperability, the lack of data standards adoption, data management issues, poor adoption of technology by the clinicians and the end users, including patients, poor access to the technology and high-speed internet, as was highlighted by one of our other distinguished panelists. These are some of the biggest barriers to adoption of digital health technology. Besides, lack of training on how to fully utilize digital health technology, what we call as a human resource, actually the human capital. Most of us as healthcare providers, as physicians or as nurses or other allied health service providers, we are not actually very well trained in utilizing these technologies. So a very high cost of deployment of such technology and not so robust payment models for virtual service provisions are also huge sticking points that the government and the regulatory bodies will have to address. So the digital modernization of the healthcare sector offers opportunities for more collaborative and participatory relationships across stakeholders to actively shape the healthcare priorities, collaborate in design of healthcare services, and participate in the deliveries. Besides addressing the challenges of digital transformation as highlighted, governments and regulatory bodies have to play a role in addressing new ethical dilemmas such as professional ethics, as well as issues relating to security, control, and protection of personal data.
Thank you, Dr. Nasseer, for sharing your thoughts and insights. Dr. Rana, how do we measure and involve patients in clinical outcome and safety? May I please ask?
Thank you, Richard. I think this is one of the most difficult questions if you ask in any healthcare system, how to measure the performance. And it has been a difficult task for even hospitals to measure performance and patient safety aspects. However, in telehealth, I think there are certain pillars which we look at the safety aspects of patients. As I mentioned, in a whole care continuum, while receiving care through telehealth, teleconsultation is, as I mentioned in my previous talk, is about correct identification, and then moving forward to assessment, diagnosis, prescriptions, and follow-up items, and anything which is not going through as should be may land a patient into trouble, whether it is a simple wrong diagnosis, if it is not properly, like Dr. Nasseer very clearly mentioned about the adoption of technology, digital health technology. Perhaps some telehealth providers use some devices, medical devices, using digital platforms for capturing some of the what do you all call it, symptoms or whatever in clinical term you say. But if that not goes well with the things, you may land up into a different situation for patients. Similarly, for medication, which is most prominent coming up as one of the risks in teleconsult is a prescription and then transcribing it over the internet or any digital platform to the patients, not to mix up with the prescription of one patient to another patient. It's not as simple as people might think, that you prescribe and then send it through. But what is that send it through? There should be a mechanism, right? What that vehicle is basically and landing up, when you type an email. When I always say to my staff, be careful sending an email which you think is very simple thing, because it's an auto mode. As you type A, all the emails starting from A land up there, and in a similar name, Richard goes to some other Richard, and that may lead into trouble to the sender and the recipient both. So similarly for here, it's really very difficult. It's not that easy what's going at the background. So capturing all those parameters correctly as you would do it in a hospital, despite we have a lot of troubles, it's really a task. And we always say in things, and basically when we started looking at the standardization processes in telehealth 2 years back, when pandemic started off and QAI, we started developing the accreditation standards for telehealth services, which are now in place. We really had these questions in mind of the technical experts, challenging them that is it the same as is going on in hospital? It's not the same as is going on in hospital. Hospital is a closed room, everything going on in the four wall of the organization. Here there is no four wall. It's an open sky. We don't really know where you are sitting as a patient and where the doctor is, where the data is being transferred, through which cloud server or physical server, we really don't know. And as Dr. Nasseer again mentioned, and it comes into the part of it, information management system and digital health applications. If you are not using the standard digital health application, the standards for capturing data and information, and then keeping it is confidentially and strictly as per protocols, we may land up into problems. So I think the high time is now to, we already have 2 years of pandemic. We have a lot of experience in telehealth delivery systems at the moment. I think the time has come up that we start looking at, as we started looking 20 years back for hospital system in capturing some data for performance. And I would say, why not even simple prescription, medication prescriptions, prescription audit, simple prescription audit to start with, for example. And the second thing I would say, the storage of data and information about the patients. If you are maybe a single doctor provider, maybe a hospital like the Hamad, the biggest in the country and in Qatar, I think is a lot of data being captured. So how you're really storing them so that you meet the storage conditions, as well as the timeline up to what time you should be keeping them with you, and also making the confidentiality, so that everyone heard that how the breaches happen in the internet domain. So how breaches can be stopped. So I think there are a lot of things, and this is a challenging, and I think we all are geared up to the next level for telehealth, that start measuring some of the parameters and looking for that how we can help and support patient safety through the telemedicine. Thank you so much.
Thank you so much, Dr. Rana. Thank you. Dr. Gursev, that brings me for the final question to your end. Does telehealth have an effect on the doctor-patient relationship, good or bad?
Thank you, Richard. Okay, so to answer your question very simply, though there is no simple answer to this, because we're still kind of exploring the boundaries of doctor-patient relationship even offline. So, I think it's both good and bad. Let me elaborate on that, because I feel good from the patient perspective, because India healthcare scenario is changing. Patients are looking for multiple opinions, second opinion, third opinion about the same disease pattern. They would want to go and see 3-4 different specialists. So from patient perspective, it becomes simple. You sit online, you take an online appointment, and in a single day, you have probably taken a consultation from 4 different specialists from 4 different corners of the country without even moving from your chair. So when something like this happens, from the patient perspective, it's good. Yes, they have better access, they have better accessibility. In what way is it bad? Because everything that is put online is not really true. So you may have doctors or hospitals spreading, I won't say false information, but maybe misinformation about the kind of technology they have, the kind of skills they have, and there's no way of measuring that. So that's the bad part of it. Now, when you come to doctors, the good part about doctors would be that yes, it kind of takes a little bit of load away from you when it comes to outpatient departments. I think one of the commonest complaints, which I think all panelists will agree with me, is the waiting times in the outpatients. That's the single biggest complaint from most of the patients. With timely slots being given, you can probably organize it in a better way. You can probably organize outpatient departments, outpatient clinics in a different way, keep certain days for online consults and the other days for offline consults. The bad part of this is, which though I said it as a positive point, is the fact that the doctor-patient relationship is altered forever. The trust that you can build with your patient, or the trust that you can have in your doctor,
Thank you.
in a offline environment, sitting face to face, probably cannot be achieved on an online platform. So that's probably the bad part of it. But overall, I think we are moving in a positive direction as far as telehealth is concerned. And I think that, we are looking at robotics for surgeries, where a surgeon sitting in London may operate somebody in Delhi. So if that is what we are exploring, then why not explore just the consultation part of it? So I'm fairly excited about it, and I think we're moving in the right direction, provided we have all the safeguards in place. Thank you.
Agree, Dr. Gursev, especially on the telesurgery, something where I've been involved with on certain distances. I'm not sure if there have been questions coming from the audience.
No questions so far. And if in case there are any questions, we would go ahead and send them out to you, and you can go ahead and respond to those questions.
Good, because I think we've are perfect on time with it when it comes to the allotted time slots on average with all the with all the speakers. So in that sense, if there are no further questions, I think it's best to share the takeaways from all honorable speakers. First of all, a heartfelt, sincere thank you for sharing your deep and thought-provoking insights. I've taken good notes during the day, Ms. Hana, with their insights on the applications of the patients. And I think what stuck with me was the triage aspect on the various types of DM2, diabetic mellitus type 2, mental health system, and how to educate the patient moving forward. Dr. Ahmad, with a sincere, deep thought on the end-to-end security for telehealth. And I've seen that work in remote cardiac vascular robotic surgery, where indeed we had the need for a solid platform, but also the implications when you operate cross-border, and how does that work from a legal point of view. So that was a takeaway message. MIT has some good work on that. Dr. Nasseer, I think the key takeaway there was how to make a business model that is not only suitable for today, but can accommodate the investment cost. And we had some contact yesterday night. The new world may go from operational expenditures or from capital expenditures to operational expenditures, but also how to balance the outcome for the patient and the outcome on cost level. Dr. Rana, with his thoughts on the Q&A side of things, where we should, that we do not always know what's going on the background, and that we are limited within the four walls within the hospital, but we're out and open and about when it comes to telehealth. And Dr. Gursev, with a profound and deep experience on reaching the further and remote regions, and at this moment he only enters the patients, that it does not make sense for patients to travel a long distance, and he only sees them pre-op and during surgery. Dr. Gursev also highlighted the need for supporting Dr. Ahmad in the need for secure technologies to connect between the patient and the physician. If these are all the questions, and if there are no further thoughts, my solution and suggestion for moving forward is, I think, the same takeaway message. Nothing is more powerful than an idea which time has come. And that means, according to three-box strategy, we need to manage the day, transform what we need to transform with an eye on the future. Thank you for your time. I'm humbled and grateful to be here. Wishing you all a good day.
Thank you.
Thank you. Thank you, Richard.
Bye-bye.
Thank you very much, Richard. Thank you, panelists. Cool,
Thank you.
Thank you very much, dear panelists, Ms. Hana, Ms. Nasseer, Dr. Nasseer, Dr. Gursev, Dr. Bhupendra, Dr. Ahmad, and Richard, our panel moderator, for an extremely interactive, insightful discussion. It is indeed good to focus on challenges in sustaining, telehealth, and I'm sure it's important for all of us as well. Thank you once again, and I wish you the very best for the rest of the day.
Sure.
Thank you.
Bye-bye, everyone.
Thank you.
Nice to see you, Bridget. Great support.
Bye.
Thanks.
Bye.
Bye.
Thank you.
Bye.
Thank you.
Right, moving on.
Bridget,
We have
yes, I was in the middle of the clinic, so I was seeing in between the patients also. Excuse me.
No problem.
I
No
really
problem.
appreciate it. Yeah, thank you very much.
Thank you. Thanks for joining.
Thank you. Thank you. Bye-bye.